Okay, ma'am.
Are you ready? Okay,
Yes,
so if you have read and understood considering it surgical anatomy station, please tell me what are you looking at?
I'm looking at lateral and medial aspect of the foot bones.
Bones of the foot. All right, okay. Would you be able to identify number one here?
Yes, it is calcaneal tubercle, anterior tubercle of calcaneum.
Okay, can you please identify, right, number four here?
This is head of talus,
Okay, 21, please.
navicular tuberosity.
If you could identify two, please.
Is I think it is in first medial cuneiform
Cuboid,
cuboid. Sorry,
right? Okay, if you could identify number 12.
number 12. It's medial process of calcaneum.
Yes, middle process of calculus. If you'll stop moving, then voice won't distract. Okay, if we could come over here and if you could identify 19.
It's tarsal sinus.
Yes, what's the significance of it?
Uh, by this, we can know what size of the foot we are looking at, and there are also a few ligaments that pass through it.
Okay, right. If you could identify, all right, if this number two and this number two is the same, can you identify and confirm?
Yes,
All right, good. Right. If you could identify number four here.
yes,
If
it's neck of talus. It's neck of talus.
yes, yes, he's sitting among family, I think. All right, so it's neck of talus. Right. If you could identify 9.
It's posterior tubercle of talus.
All right. If you could tell me, uh, all right, if you could tell me how the arches of foot are formed.
There are three arches: medial longitudinal arch, lateral longitudinal arch, and transverse arch.
Okay, please
Uh,
tell me the components of medial longitudinal arch.
Medial long medial longitudinal arch is formed by navicular and talus,
Yes.
with three cuneiform and three medial metatarsals.
Right. And not just that, this is the bony part you're telling me. What about the ligaments and muscles? Very quickly.
Yes, the ligaments are interosseous ligament, plantar ligament,
No
long plantar
plantar.
ligament,
What do you
long plant.
understand by the spring ligament?
Yes, it's also a component of medial longitudinal arch.
Yes. And muscles,
Along,
very quickly. This all you should tell me in one
yes,
round. Like,
the muscles are anterior tibialis, posterior tibialis, and short muscles of big toe and flexor hallucis longus in the medial longitudinal arch.
flexor hallucis longus, diastrom longus and brevis, and then both tibialis anterior and posterior, right? What is the purpose of these arches? Why do we need these three arches in the foot?
In walking, they give us propulsion and also shift the weight for the stability on the
Okay.
arches.
All right. Any other? Okay. Yeah, propels in gait and gives stability while standing. Okay, please identify the in picture C and D and E. There are certain structures which are circled. Please identify them.
Yes, this one is the deltoid.
Yes, what are the components of the deltoid ligament?
There are four ligaments: tibiotalar, anterior tibiotalar, posterior tibiotalar, tibio calcaneum, and tibionavicular.
Very good. What's the purpose of deltoid ligament?
It gives stability to the medial aspect of the ankle joint.
All right. Okay. Please. Okay. You have told me this. Right. If you could identify 18 and 26 as well.
And 18 is spring ligament,
26.
and 26 is navicular tuberosity.
Okay. Please, if you could identify 18 is not actually, it's not labeled as spring ligament.
Sorry, 17 is spring, and 18
Yeah.
is short ligament.
No, 18 is spring. Okay. Sorry. All right. If you could in picture D identify 1 and 3. 18 was correct. In the bracket, it's spring. The 17 is short plantar. Anyway, sorry. 1 is
One is anterior tallow.
fibular,
Forgot.
talofibular ligament. 3, please.
This is calcaneofibular.
Okay, yes, please. If you could identify 3 and 19 in picture E.
3 and 19 in picture E. Yes, 3 is calcaneofibular, and 19 is inferior transverse tibiofibular.
Okay, would you be able to tell me the structures which are present on the medial and lateral aspect of the ankle?
Yes, the structures behind the medial malleolus are posterior tibialis, flexor hallucis longus, flexor digitorum longus, tibial nerve, posterior tibial artery.
Okay, what are the bones which form the ankle joint?
Trochlear surface of talus, tibia, and fibula make the ankle joint.
Yes. What type of joint is ankle joint?
It is the synovial joint.
Hinge type of synovial joint. Okay, what are the movements which occur at or present at the
Dorsiflexion and plantar flexion.
Please tell me why ankle joint is most stable in dorsiflexion.
Because the anterior part of talus is articulating with the tibia, which is the most wider part. But in plantar flexion, the posterior part of talus is articulating with tibia, and there is more space uh, that may cause fracture in the plantar flexion.
Okay, if you could tell me where exactly, looking at this image, would you palpate for arteria dorsalis pedis? Pulse.
Uh, I will palpate the first and second metatarsal, and between the extensor hallucis longus and extensor digitorum longus tendon.
Mm. Are you sure it's extensor hallucis longus? And what is the other?
Extensor hallucis longus and extensor digitorum longus.
Think, okay, right. Would you be able to identify here where exactly?
Yes.
Your voice disappears when you move with your.
Nine is the dorsalis pedis.
Yes, arteria dorsalis pedis, is it 9? Where exactly is 9? Okay, here. So here you'll feel the pulse. You sure?
No, I think I'll feel it a little proximally at
Yes,
3.
at 3. That's why. Yes, 9 is digital. No, you won't be able to feel the pulse there. That's digital vessel. All right. Please identify 17, please.
This is anterior tibialis.
Please identify 7.
7 is extensor digitorum, extensor hallucis longus.
Yes. If you could identify 6, please. Your voice
longest.
disappears when you move your head.
Extensor digitorum longus.
Yes, 5, please.
5. I don't know. Sorry, can I
Extensor,
come back to this?
this is extensor digitorum longus, right? 5. And 6 is extensor hallucis brevis. This is short brevis. Okay, if you could identify number 12.
12 is erroneous testis.
Who? Oh, your mic.
Hello.
Yes, disastrous.